Now, two of the three legislators that proposed the immigration bills, one was Senator Mike Jorgensen from Hayden, the other one was Representative Phil Hart from Athol. I'm from Coeur d'Alene, and I know that the demographics up there, it's about 98% white, and then African Americans and Latino Americans, if that's a proper term, they make up the rest of the population approximately. Why do you think that two legislators that are from such a heavily Caucasian area are delving into an issue of immigration when it's probably most likely not a problem in their area? Is there election year posturing going on, or why do you think that's going on?
You know, I didn't speak. I spoke to one of those legislators about the bill, but I didn't speak to either of them about sort of their motives. I did speak to legislators that introduced the third piece, and in that instance, I think they, I wouldn't call it political posturing, and this is about Senate Bill 1270, but they were concerned because they're hearing from their constituents. You know, they're hearing some frustration and they want something done. And so this, you know, they attempted to do this, and I understand that. Why Senator Jorgensen and Representative Hart would do that, I don't know that they're at risk in their district. I don't know that it's something that they're getting pressure on. I think, you know, they may hear from their constituents just as the Canyon County legislators did. I think that for those two particular legislators, it's an issue that's very important to them, and it has been for the past, you know, this is my fourth session doing this job, and it has been since I've been here, issue that's important to both of them. And I don't know that it comes specifically from their constituents or just sort of from their ideology and where they're coming from, and that it's something, you know, that they find important that they want to push. I think a lot of times, you know, I've worked with Representative Hart closely on other issues like Real ID, and I know that the way the federal government operates and what they tell the states and things that they are working on is really important to him, and so I think that may play into it. But I didn't talk to either of them specifically on the motives behind this bill.
Okay, now the ACLU also came out opposed to the health workers' conscience legislation. Why?
There are a number of reasons, and I just want to back up a little bit, sort of generally speaking about these conscience refusals and pharmacy refusal legislation, because there was a bill last year that dealt with similar issues. Different from some of the other organizations that oppose this, ACLU is in a really unique position because, you know, we value individual liberties, including religious liberties, just as much as we value access to health care and patients' rights. And so we're in this unique position where we can look at it from both sides and really value both sides of this argument. And I think that there are ways that you can draft legislation or rules from a pharmacy board that strike a really good balance between those two competing issues. Unfortunately, this bill, we didn't believe did that. There are very few patient protections included in this bill. I mean, there is sort of this, if there's life-threatening situation, then a healthcare provider's got to provide these services until an able provider can step in. What I think the bill, the bill was drafted by someone from Idaho Chooses Life, and they worked on it last year and really focused on the pharmacist and the pharmacies and the dispensing of emergency contraception, and I don't doubt that that's part of the impetus behind this bill. And so I think that's really sort of where I see the issue, one of the main issues of this bill. And what can happen here in Idaho when we've got, much of our state is rural, and not every county even has a pharmacy, and those that do may have one. And it is a big deal. In Boise, we can't imagine why this would be a big deal.
Yeah.
Like, you can go to Albertsons on Broadway, and if they don't want to do it, there's a pharmacy next door in the same shopping center. But if you're in rural Idaho, and you were raped or you had unprotected sex and you want to access emergency contraception, which is an over-the-counter drug for people 18 and over, and you go to your pharmacy and they refuse to give it to you. They've got it behind the counter. They may have it, but the individual refuses to give it to you. You may not have transportation, and the next pharmacy may be more than 50 miles away. this is a time-sensitive drug. You know, the longer you wait, the less effective it is. And it can be life-changing for someone, you know, to be able to access this. So that's sort of where the problem comes in. And, you know, I think we can think of a million hypotheticals of what could happen. I also don't think that there's been a problem with pharmacists or other healthcare providers being forced to do something that they don't want to. We would take that very seriously. If that happened, we would want to hear, you know, from an individual and see what the circumstances were. But I think probably what does happen in those instances is they work it out with the employer. I mean, we get complaints every day about different things, and we have never heard of anything like that happening, of a pharmacist being forced to provide a service that they don't want to, that they find, you know, morally objectionable. I think they just work it out, and that's letting the marketplace work it out, and that's something that, you know, usually Idaho legislators are very they find very important, sort of letting the marketplace work things out.
Right.
And in this instance they didn't do that. And so because it didn't strike that balance, it sort of it favors religious liberty of the healthcare provider, almost you know, with no exception, over the patient. And this patient and doctor have a relationship, or another healthcare provider, that they're sort of completely overlooking. Right. And it can really put the health of an Idahoan in jeopardy.
Okay.